Hello, everyone. This is Betsy Wurzel. You're a host of Chatting with Betsy on Passionate World Talk Radio Network, which is a subsidiary of Global Media Network, LLC, where our mantra is to educate, enlighten, and entertain. Folks, September is just around the corner. September is World Alzheimer's Awareness Month, and good timing for my two guests today, which I'm so honored to have with me. With me today is Dr. Emily Clionsky, who is an internal medicine doctor with 25 years of experience. She has treated thousands of patients with memory loss at a private practice, and they're a husband and wife team. Dr. Mitchell Clionsky is a board-certified clinical neuropsychologist with 45 years of experience evaluating treating patients with cognitive impairment, dementia, ADHD, and traumatic brain injury. Together, they developed the Memory Orientation Screening Test, which has been used by hundreds of doctors. They wrote this fantastic book, Dementia Prevention, Using Your Head to Save Your Brain. And let me tell you, folks, I would run to your bookstore, order from Amazon. If you're a college student, buy this book. Give it to your parents. Everyone should be reading this book, especially as we're having an aging population. I firmly recommend this book very highly. And I want to welcome Dr. Emily Clionsky and Dr. Mitchell Clionsky to Chatting with Betsy. Welcome.
Well, thanks for having us, Betsy. Just feel free to call me Dr. Emily, and you can call Mitch Dr. Mitch if you want, or you just call us Mitch and Emily. It'll be easier.
Sure, thank you for screwing up your last name. Well, thank you. Thank you so much from the bottom of my heart for writing this book that I am so thrilled about. And I always ask the writers, what motivated you to write this excellent book?
Well, let me take that. It's really a process of working backwards. What I mean by that is that when Emily and I began seeing large numbers of people for memory loss, we really wanted to provide them with state-of-the-art treatment by looking at all of the potentially reversible causes of memory loss, then treating their memory loss with existing medications and lifestyle changes. And we found that by doing this very comprehensive intervention, that many of our patients didn't progress at the rate of decline that other people's patients progressed at. In fact, we did a presentation at the 2014 American Academy of Neurology Conference in Philadelphia, where we followed more than 780 patients over 2 years and were able to demonstrate what an advanced treatment protocol for dementia could benefit people. And then we said, this is working so well with people who have mild to moderate forms of Alzheimer's disease, vascular dementia, whole variety of the many dementias that there are. Let's try this earlier with people with mild cognitive impairment. They weren't yet suffering from dementia, but were on the fast train to dementia. And we got even better results. Consequently, we said, these same issues, these same problems that lead people to develop mild cognitive impairment and later on, in many cases, to get dementia, what if we intervened before they began to have real problems? And at that same time, we attended a conference in Boston, sponsored by Harvard, on getting doctors to be better writers. And we had written articles, journal articles, scientific articles, but it thought, what would it be like to write a book? We went to this conference, and we persuaded Johns Hopkins University Press to publish a book on dementia prevention, and that started about a 3-year odyssey of putting together all of this information and really focusing on the science in a wide variety of areas. So we wanted things that were really scientifically based, not just eat this, do that kinds of, the things you see on your Google where they send you a headline and you think, oh, wow, this is going to fix my cognitive concerns. And then being able to translate that information into terms that everybody would understand, because it doesn't do you any good to read a book and say, well, they seem to understand what they're talking about, but I can't use this information. And so that started this whole process of doing a book that would be readable by people in the general population, and that would have the net effect of reducing the risk of dementia by 50%. And that's really what the goal is here. The more people we can get to understand these principles and apply them to their own lives, we can make a significant difference in the overall cognitive health of America and the world, for that matter.
That sounds excellent. Usually, way back, we didn't hear about prevention, right? We're told there was nothing, you can do. I'm so glad there's a book that you wrote this book to tell people, you can try to prevent it by your diet, avoiding heart disease, diabetes, not smoking, not drinking. There's so many ways that we can prevent it. And are you on the belief that you can change if it's hereditary, if it's in your family, by trying to prevent it by diet and exercise? Does someone have a chance to beat getting it?
Well, I'm glad that you asked that question, because while we can change who our parents were, much to my chagrin at some points in my life, we can't change our genetics. We certainly can modify the risk, the degree of risk that those genetics confer. And I was really happy to hear you, when you opened your segment today, to hear you tell college students to go out and buy this book. And I would urge them to read it before they gave it to their parents and their grandparents, because the reality is, the sooner people start to learn how they can change those unchangeable, those genetic risks, or what happened to them when they were young, that their head concussion that resulted from going over the bicycle handlebars when they were 8 without a helmet on, playing football or soccer and doing a lot of headbutting when they were in high school and college. All those kinds of things that we didn't think were important when we were younger or couldn't change. If we get into our 20s and 30s and start to pay attention to the modifiable risk factors, it will produce a tremendous risk reduction later in life. Let me give you for instance, that's a very good corollary. We know that if we can get someone who's in their 60s to reduce their low-density cholesterol, their bad cholesterol, LDL, down to 70, that we will reduce their stroke risk by a significant amount, by like 10%, when they're in their 60s and 70s. If we can get that person or someone to reduce their LDL to 70 when they're in their 30s, we will reduce their stroke risk when they're in their 70s by 70%. That's huge. So the message here is, start to make these changes as early in life as possible. But, a lot of us are coming to these facts when we're in our 40s, 50s, 60s, 70s, and even 80s. So we got to play the ball where it lays, and you can use these modifiable factors to make changes in your cognition regardless of your age at this point.
And even if you already have a diagnosis of dementia,
right,
that's the other thing, is even if you're already diagnosed, making lifestyle changes can make a big difference in the rate of progression or stability that you have and keeping yourself more functional, living alone or living at home with minimal kind of supervision for much longer periods of time.
And you can actually see that study that Mitch talked about and that we're alluding to right now, because we were working in our practices with people who were already diagnosed with dementia at different stages as well as mild cognitive impairment. And by implementing the changes and the factors that we have in this book, these people improved their cognition over time and stabilized it for the 2 years during that study, which is significant.
Yes, and you mention in your book, like a lot, exercise. And I just have to say from my own experience, one of the neurologists told my husband, exercise is the best medicine you can do for yourself, better than any pill I could give you. Work up a sweat. And that did. He would take a walk until he couldn't walk by himself anymore. But I believe that helped. I really do. I believe that that's why he progressed slowly.
Well, the research would tell you that it does. And the funny thing is, we have known about this kind of research. It's out there. We could do an entire 2-3 pages of references just on the research on exercise benefit, starting way back 40 years ago, where they took a look at nurses who exercised versus nurses who didn't. There's other studies looking at veterans who walked 9,000 steps a day versus veterans who walk 3,000 steps a day. You go anywhere and look in the literature and you'll find evidence that's very compelling about the value of exercise. That's not the problem. When we tell people to exercise, they never tell us that it's bad. They simply tell us why they don't. And so the issue is one of overcoming their resistance. I tell them they have to first, to start making changes in their life, I tell them, you got to examine your butt. And they look at me, and by the way, I have not broken your rule about no swearing. They look at me, and they say, what? I say, yeah, your butt, not the one you're sitting on. The butt that goes in the sentence, I would exercise, but whatever comes after that is what you have to focus on, because that's where the problem is. You have developed rationales, reasons, excuses, things you tell yourself. Oh, it's boring. I would exercise, but, I don't have the time. I would exercise, but I don't like to get sweaty. I would exercise, but if people have I could do a list of those reasons that don't help them because they get in the way of their making a change. And the first step is examining what's your butt and how do you get around that?
Yes, that's very true. I have to ask you both your opinion on cholesterol medication, statins, because there was controversy about that, about it robbing the brain of cholesterol, which might increase early onset. What's your opinion on that? I have to ask because I'm so curious.
Yeah, I'm going to give Emily in a second, but there was at least one study that suggested that Lipitor, atorvastatin, was involved in reducing memory function. I don't think that's ever been replicated, and I've seen people who have stopped taking statins as a result of that study, and none of them appear to have gotten any better as a result. But I'm going to let her talk about cholesterol itself, because I think we're going to address it better.
Yeah, one of the most important things to appreciate is when you read our book, the scientific research that we have in that book is the result of large, well-done, well-researched, peer-reviewed studies that have been replicated. The important thing about science, one of the important things is that you be able to reproduce the results that you got in one study, in a second study, a third study, a fourth study. So the real bulk of the evidence about atorvastatin and its effect on cholesterol and cognition has never been replicated. And we know that, in fact, the bulk of the evidence suggests that LDL is one of the major factors that needs to be lowered in order to reduce the plaque buildup in microscopic and large blood vessels, not only in the brain but also in the heart. What you do to the heart, you do to the brain. What's going on in the brain is happening in the heart. So the most important thing is to exercise, control the triglycerides, which eventually, as you know, 5 little triglycerides become 1 LDL. So you need to reduce both of those. So a combination of a cholesterol-lowering agent plus exercise is a powerful method of controlling the plaque buildup as well as the inflammation that leads to additional blood vessel damage in the brain.
Yes, that's very good points to tell the audience. I know that my husband was on statin. That's why I was curious, and his mom was on statins, and I believe my other family members were. I was on for a while, and I couldn't take it anymore because it hurt my muscles, affected my muscles. And I, do try to watch what I eat, but I tell young people that I've said it on the show, stay as healthy as you can, because as you get older, and as you go on Medicare, and I know that might seem far away to some people, but, life goes by quick, prescriptions are out of control. It's very expensive. The medications, the more medications you take as you're older, it's going to cost you more money. So start taking care of your health at a young age. And you're right, Dr. Emily, that's great advice. College students, read this book. And also you mentioned brain injury. That can cause some kind of dementia, and people don't think about that. Look at all these veterans that were hit by missiles and have traumatic brain injury. Football players, anyone hit in the head a lot or at tremendous risk. It's just so, your book is very eye-opening, very informative. I want to ask you, about your memory orientation screening test. Is this available in doctors' offices, or do they have to ask for that?
Unfortunately, right now it's not available. It was distributed by Quest Diagnostics for about 5 years, and we had bought the rights to use this across the world, but we were not allowed to distribute this separately from them. About a year ago, they stopped distributing this particular test. We're in the process of redoing it, with upping our normative data and re-releasing it, but it's not out there yet. Hopefully in the next 6 months or so, because I think the primary care doctors in particularly will welcome a 5-minute test that they can give to somebody at an annual wellness visit or just a regular sick visit to be able to track what their cognition looks like.
And Betsy, I've got a question for you. I'm curious, if based on your knowledge of the public and your audience, if people had the ability to do a 5 to 10 minute test with a report generated as a result of that, of one of their loved ones that they were concerned about, something they could take to the doctor and say, here, this is what this test said. Do you think that they'd be interested in using it?
I would. I definitely would. From my experience, Dr. Emily and Dr. Mitchell, just getting the doctors back then to believe that your loved one's having a memory issue, if they would have had a test like this, that would have helped. I would jump on that. I would definitely. If I was having memory issues, I would jump on it. Yes. Definitely. And I could tell you both that I've been talking to caregivers for 7 years, 6 on the station and just out on Facebook social media. And one of the, two major complaints, doctors didn't believe them. And when they were giving that neuropsychological test that's like 5 or 6 hours, and they could not do it because of their cognitive ability to, their memory wouldn't let them, they couldn't. And to be accused by the doctor that they're being non-compliant was such a disgrace. I hope things have changed. I only hope. And I think your book is definitely a change, a welcome change. I wish I could clone the both of you and put you all over the world.
Well, part of the reason for doing the book was exactly that reason.
Because we can't be cloned.
Yeah, because how many people can we talk to in our office on a weekly basis? And it's pretty minimal. And the book was an approach to getting the word out, because we'd want this to be a movement, not a book. We'd want people to take this and say, okay, I tell people when we do talks, I say, you're now our dementia prevention ambassadors. You have to go out and spread the word that, number one, it's something which can be prevented, and that the likelihood of preventing it is much higher than anyone had anticipated. It's 50%. It's half of all cases. If we had a drug, a medication that could cure 50% of the cases of dementia, it would be so fantastic. The stock on it would be impossible to purchase. People would be lined up for miles to get this.
And would be billionaires if we were the ones who came up with it.
But
yes,
it's not,
prevention isn't sexy.
That's right.
Yeah,
it's not our data that tells us that, is that the 50%. That is real well-established data from large-scale studies. So it's not just a secret formula that we have. We just feel like we've done a better job of trying to explain it.
And put it in the hands of people who really want to make a difference in their lives and the lives of their loved ones.
Yes. Well, in my opinion, this book gives people hope. There's now hope that dementia can be prevented if we take care of our bodies, and hopefully not wait until you're 50 and 60 to take care of it. This is why this book is important to get in the hands of young people. And read, if you're a university student and you're listening to this show, and we have a large university audience, read this book, and it will hopefully you can, prevent dementia in your own life. There's a ray of hope, because before we didn't hear about prevention. 14 years ago, I didn't hear about it. 24 years ago with my mother-in-law, you didn't hear about that. And I'm so thankful, really, for you both in writing this excellent book. And I really can't recommend it enough. I know it may sound redundant, and I don't really care, because this is my heart. Alzheimer's. When your family is affected by it, when you're affected by it personally, you want not just a cure, but let's prevent it. Let's stop it from even happening to begin with. And what can we do to do that? And it's in your wonderful book. And you're just, I'm just thrilled. Sometimes I can get speechless, but thank you.
It's touched our lives as well. My mom developed dementia in her mid-70s. So we've been on the family end of this as well. And it's also more motivating, perhaps, than it would be if your life had not been touched by it, to say, what am I doing every day to reduce my risk? Because I don't want to end up in that state. I don't want to lose myself as she did. I don't want to become dependent on others like she had to be. And that's a very motivating thing. So there's not just a professional stake in this. This is part of our mission as children of someone with dementia, or a relative of somebody who's had dementia.
And interestingly enough, to follow up what Mitch said, 1 out of 6 millennials in the United States today is actually affected by a family member or a loved one, or is caring for a loved one with some form of dementia. That's huge. That's a huge impact on the lives of those young people, as well as the health of the country and the well-being of the person for whom they are responsible. Mm-hmm. The interesting thing is Mitch is about to go back to his old alma mater, Dickinson College, where he's been invited to address one of the psychology classes. And so, we are more than willing to help any college professor do a segment on dementia prevention as part of their curriculum. We urge book clubs to focus in on this book because that's a way to get it out into the general population. Some church groups have been very interested in circulating it in their PTA groups and their school groups. So anything where you've got a group of people who are really kind of conscious about their own responsibility for their health, this is a good book to read.
Absolutely. I'm actually going to give it to my son to read because he is at very high risk, and I always encourage him to exercise and to eat healthy, because both sides of the family, and plus he has a cognitive disability to add to that. So that makes him high risk. But I can't thank you both enough for coming on my show and writing this book. The name of the book, folks, and it will be in the blog, Dementia Prevention, Using Your Head to Save Your Brain. I love the title of that. And where can people purchase your book? Sure, go ahead, Mitch.
I was going to say that we also have a website that really has a lot of information. So, you can purchase the book through a number of places. You can get through Johns Hopkins Press, but you can also get it more easily, I think, through Amazon. You can get it as a download on Kindle. You can get it through iPad and read it on your device. Or you can listen to the audio book, which is narrated by an actor named Nan McNamara, and she's really good. I tell people that there's a joke in the first chapter, and she tells it better than I do. She tells this joke. I laughed at the joke. I said, I wrote that joke. It shouldn't be so funny to me, but just the way she tells it, it's really adorable. So there's a number of ways of getting it. But our website, which is called BrainDoc, BrainDoc, BrainDoc.com, has a wealth of free information, including, I think there's 55 audio and audiovisual podcasts that we have done for a lot more information than you can possibly squeeze into any single hour interview. It's got articles that either we've written or have been written about us. And the book, there's a link to the book. There's other information about our test. Plus, there's something called the Dementia Prevention Checklist, which is a 25-item questionnaire that a person can fill out, and at the end of it, get an assessment of their personal dementia risk. So we think this is really important because you can read about all the different, there's 20 different factors in our dementia prevention model. Some of those will be relevant and others won't. And yet, when you look at the whole picture together, you see where the interconnectivity is. And I'm sure you saw that in the book, that we talked about how each of these separate factors does not just by itself impinge on dementia risk, but it also ping-pongs, back and forth with a number of other factors. If you're overweight, you're not exercising. If you're not exercising, you're oftentimes not sleeping well. These are all connected one to the other. And so that's a way of people getting a sense of, here's my personal dementia risk. How do I go about changing that?
That sounds excellent. I love that. Yes, I was going to ask about your website, which will also be in the blog. A wealth of information. I went on the website myself, and there is a lot of information, a lot of great resource material, and I just am thrilled. I am thrilled that things are changing slowly, but they are changing in the Alzheimer's community. And I want to thank you again, Dr. Emily and Dr. Mitchell. Go ahead, say your last name for me.
Clionsky.
Clionsky. Thank you so much. Folks, sometimes, you know what, my mouth goes ahead of my brain or my brain goes ahead of my mouth, but I get excited because it's been a long time coming, let me tell you. And a wonderful book like this, and to see people out now that are showing their journeys, showing their faces, they're speaking up, finally. And I want to thank everyone who is showing their journey. Keep at it. Keep doing it. We need to personalize this disease with names and faces. And I'm so glad that things are finally changing, and I hope that they are changing also in the medical community with doctors being more receptive and listening to the concerns of a patient who comes in with memory problems and memory concerns. I really hope that has changed in the past 10 years. But I can't thank you enough, you both, for coming on, writing this book, and helping other people and doing what you do. Thank you so much. I appreciate it.
Keep fighting the good fight, Betsy.
Thank you. Thank you. Thank you very much. And, folks, I want to thank you for listening. And please subscribe to Chatting with Betsy. It is for free on iHeart, Amazon Music, YouTube, just to name a few, excuse me. And all the information about the guest today will be in the blog that Jeannie White, the station manager, writes, and Jeannie produces the show. So thank you, Jeannie, and thank you to Lillian Caldwell, CEO of Passion Real Talk Radio Network, who makes this all possible. And please, folks, share this show with someone. I'm here to help you, to be a resource, to help you have a better life. And the only way I can reach people is if you help me. So when you do that, you are not only helping people, but you're honoring my husband Matt's memory. And I really appreciate that. And I just thank you all. Chatting with Betsy will be 5 years next month. So thank you, everyone, for your kindness, your support. And as I always say at the end of my show, in a world where you could be anything, please be kind, shine your light bright, because we need it now more than ever. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate Real Talk Radio Network, a subsidiary of Global Media Network, LLC. Bye-bye now.